So, good morning everyone. My name is Dalla Costa and I'm going to present to you the results of a study we carried out in order to assess the value of serum neurofilaments in the prediction of visual outcome after an acute optic neuritis. As you know, optic neuritis is an inflammatory process of the optic nerve that is typical of multiple sclerosis. After an acute optic neuritis, the prognosis in terms of visual acuity and function depends upon the amount of axonal damage that has occurred. In this regards, two new tools are emerging to monitor this. The first one is optic coherence tomography that can quantify the thickness of the different retinal layers. And the other tool is blood biomarker, neurofilament light chains, the backbone of neurons released into the stream following axonal damage. Therefore, the aim of the current study was to assess whether neurofilaments would predict the visual outcome after an acute optic neuritis. In order to do so, we prospectively recruited patients within 3 months from the occurrence of an acute optic neuritis. At baseline, we collect baseline blood samples from each of the patients and measure neurofilaments through use of Simoa, through use of the Simoa technology. At baseline as well as in the follow-up, we also tested each patient with visual acuity tests and OCT scans. And finally, multi-level mixed effect model have been used to test the primary endpoints of the study. And here you can see the results of our study. In total, we have been able to recruit 31 patients, that is 62 eyes. The mean age of the study cohort was 37 years, approximately 2/3 of them being females. The mean follow-up was 27 months. And I think it's important to note that 1/3 of patients had gadolinium and non lesions at the optic nerves at baseline. And mean level of baseline neurofilaments was 11 picogram per ml, which is typical of multiple sclerosis. In the table, you can see different visual acuity and OCT parameters at baseline for both the affected and unaffected eyes. And here in the left panel, you can see the intraocular difference in visual acuity according to baseline neurofilaments levels and how this difference evolved over time. Particularly, it's quite apparent that patients with highest levels of neurofilaments at baseline did not recover in the follow-up as the intraocular difference further increased. And this was also true for intraocular difference in the thickness of the RNFL at OCT, you can see in the right panel. In this table, you can find the effect sizes in the phenomena we have just seen, particularly patients in the upper quartile of neurofilaments had a significant increase in the difference in standard visual acuity test between the two eyes, 0.05, and also the difference in RNF thickness increased by 0.64 micrometer per time point in the follow-up. So, to conclude, we can say that neurofilaments are a promising biomarker for predicting the outcome after an acute optic neuritis, but of course further studies with a larger cohort of patients are required to validate our preliminary results. And I'd like to thank you for your attention.